It is no secret that good nutrition is essential to a healthy lifestyle. This is especially important before and during pregnancy. While a healthy mother most often means a healthy infant, a majority of women aren't sufficiently aware of the necessary nutritional requirements needed to achieve a healthy pregnancy. Dr. Andrea Lucas, President and CEO of the Carolina Women's Research and Wellness Center and founder of the OBGYN Alliance, a nationwide peer-to-peer network of OBGYN physicians.
The most common misconception is that a woman is eating for two, when in fact she only needs on average 300 more calories during her pregnancy. Quality is more important than quantity, so we emphasize good nutrition both before pregnancy and after pregnancy. We emphasize exercise, and we like women to eat healthy fruits and vegetables, lean sources of proteins, whole grains, and then take the right supplements in terms of vitamins and minerals.
According to Dr. Lucas, good nutrition shouldn't just begin following conception, but rather in the preceding months and even years.
Good nutritional habits need to begin before pregnancy. The fetus's nutritional needs are great and will compromise mother's nutrition during pregnancy. So mom must have a good nutrition even before pregnancy.
Dr. Lucas urges women to consult their OBGYN for proper nutritional advice. She also encourages OBGYN physicians to take a nutritional course on the OBGYN Alliance website.
When women become pregnant, they're very motivated to eat well and make healthy choices. So the physician should provide them with the tools to help them make the right decision. Through the OBGYN Alliance, we've formed an online educational tool that provides physicians with information on nutrition. In fact, we give a handout to the physician for the patient that focuses on good nutrition, stressing the importance of folic acid, iron, and omega-3.
Dr. Lucas also encourages women to seek a certified nutrition consultant to offer tips to maintaining a healthy diet. Her colleague, Beth Reardon, is Director of Integrative Nutrition at the Carolina Women's Research and Wellness Center and the Integrative Nutritionist at the Duke Center for Integrative Medicine.
Without question, one of the most important nutrients that a woman needs to consume prior to conception is that of folic acid. Now, compared to naturally occurring folic acid in food, that which is supplied by a supplement or fortified foods is actually twice as well absorbed by the body. Folic acid is critical for ensuring proper growth and development of the embryo and to reduce the occurrence of neural tube defects such as spina bifida. One of the critical roles of folic acid in the body is also for normal cell growth and development of the fetus. What this helps with is to reduce the occurrence of recurrent miscarriages, to prevent preterm labor, and to reduce the incidence of low birth weight babies.
Foods rich in folic acid include fruits and dark leafy greens, dried beans, nuts, fortified grain products, and cereals. Drinking orange juice also provides essential folic acid. According to the U.S. Food and Drug Administration, a pregnant woman should consume an additional 300 calories daily to maintain a healthy pregnancy, equal to a half a sandwich or an extra couple of servings of fruits and vegetables. This is not as much an increase as many women perceive. In reality, many women consume too much food and gain excess weight, which can result in complications for both the baby as well as themselves.
A baby's weight is directly related to the weight that mom gains during pregnancy. For the mother, gaining too much weight can cause gestational diabetes, but also at the time of delivery, there can be more birth injuries. And then for the baby's at higher risk for later in life to develop hypertension, diabetes, as well as coronary heart disease.
On the other hand, not gaining enough weight can result in a lower birth weight, which brings its own risks.
There are specific recommendations set forth by the Institute of Medicine for normal weight gain. But in general, a woman should gain 2 to 4 pounds during the first trimester and then 1 pound per week for the remainder of her pregnancy. Not all weight gain is associated with the baby. A mother will gain weight due to enlarging breasts, amniotic fluid, the uterus enlarges, and there's amniotic fluid.
The recommended dietary allowance, or RDA, is the average daily intake of a nutrient that is determined to be sufficient to meet the needs of nearly all, 97% to 98%, healthy members of a specific age and gender group.
The RDA gives you specific amounts for each mineral and vitamin during pregnancy. For instance, with vitamin A, this is a vitamin important for normal vision, reproduction, immune system. When taken in excess of 10,000 international units, birth defects can occur, mostly within the nervous system. So the RDA gives us those recommended amounts for each vitamin and mineral.
Iron is essential for a healthy pregnancy and a healthy baby. Due to the fact that a woman's blood volume increases by almost 30% during pregnancy, her iron needs as a result increase as well. The CDC recommends that a low-dose iron supplement of about 30 milligrams per day be consumed by women who are either thinking of becoming pregnant or are pregnant. Now, iron can be found in many foods that we eat, such as red meat, poultry, legumes, and beans. These, however, are often not well absorbed unless foods that are high in vitamin C are eaten along with them. So again, for this reason, an iron supplement is often recommended.
Omega-3s are a type of polyunsaturated fatty acids found in a variety of foods, including cold water fish, nuts, seeds, and plants. These are considered essential fatty acids because our body cannot make these. According to the American Heart Association, omega-3 fatty acids help to reduce cardiovascular risk in all people, due in part to their anti-inflammatory benefits.
In the past decade or so, we've really begun to understand the importance of omega-3s in terms of the neurocognitive development of the baby. If we take a look at the development of the brain, over 60% of the brain is composed of DHA, which is one of those essential fatty acids. Now, if it's not supplied by the diet in the form of cold water fish, then it must be supplied in supplement form because, again, these are essential and are not made by the body. It's most important that the mother consume these omega-3s in the third trimester of pregnancy when the greatest amount of development of the baby's brain is going on.
There can be risks with vitamin supplements, especially when taken in excess. So moderation is key, and women must consult with their doctor to find out what is best for them. A healthy pregnancy starts with good nutrition and helps ensure a healthy baby.
For more information on proper nutrition before, during, and after pregnancy, consult your OBGYN and clinical nutritionist.